Still talking health, Nigeria is still on a long road to reaching the Sustainable Development Goals 3.2 target that of averting over 3 million under 5 deaths by 2030. At a two-day media dialogue and field trip on sick and small newborns and zero-dose children in Calabar, Cross River State, health experts are challenging the state government and government at all levels actually to increase and implement budgetary allocations for public health facilities. According to the United Nations Children's Fund, a staggering 60% of maternal, newborn and child mortality in Nigeria can be attributed to a lack of access to quality healthcare facilities and services. This media dialogue seeks to inform the public about life-saving interventions, including functional sick newborn care units and oxygen therapy for newborns facing respiratory distress. Up for discussion is this very important issue: the number of children in Calabar, Cross River State who have not received any vaccinations.
The nutrition side, the health of the mother, and then also where she chose to deliver her baby. So one thing is about the accessibility, but one other aspect is when she then reached the facility, the quality of the care that's being provided needs to be of a specific standard for that to make difference.
The COVID, in many ways, COVID epidemic that we had like 3 years ago, in a few ways. One, the focus of the shifts in attention globally from production of other vaccines to the production of the COVID-19 vaccine. Secondly, hesitancy came up very prominently. And the hesitancy, unfortunately, did not apply only to COVID. It was extended to other vaccines as well.
The issue of zero-dose children and infant mortality in Calabar is a complex one, but with the help of organizations like UNICEF, other development partners and media professionals, perhaps Nigeria may achieve the SDG 3.2 target by 2030.
Thank you to UNICEF for all the support they've been giving to Cross River State in terms of immunization, in terms of our campaign, in terms of training of our healthcare workers. We've had a very nice relationship with UNICEF, and their support is really great in Cross River State.
To address the need for white governments need to take up from where they've stopped in order to ensure that this oxygen concentrator gets to every looks and corner of the state.
As a newscaster, I also will make sure that the information that are being given out reach all the nooks and crannies of the society. This will help them get enlightened and informed about the reality of things, especially when it comes to healthcare services in Nigeria.
UNICEF is asking government agencies to shift the focus from survival to thriving improved access to quality care and tailored interventions to the diverse needs of Nigerians.